Hello and welcome. So today I'm going to talk about our carpal tunnel and femoral contents. Both topics are very important and complicated. So try to concentrate. I will try my best to make you understand. Now, first of all, carpal tunnel. So by the name you can understand that carpal means the carpal bones in the wrist joint, okay? And tunnel means a passage. So carpal tunnel means a passage in the area of carpal bones, the wrist bones, okay? At this point you have to understand one thing. Try to remember the anatomical position of the hand. In anatomical position our hands placed like this, okay? In standing position, this palm facing forward. At this point thumb represents lateral and the little finger represents medial, okay, towards the central axis. Now if you want to see the tunnel, you have to remember that the tunnel means what? It's a passage. Something is going inside, something is coming outside. So muscle, tendons, their major arteries are going inside. Veins, lymphatics are coming outside. Okay? Nerves are going inside. So simple thing. So if you want to see this tunnel, you have to look from above, okay? Superior view. Not from anterior, not from posterior. Superior view. To watch this tunnel from superior view, you have to cut the wrist in transverse section. Okay? Transverse section and put the wrist like this and watch what is going inside, what is coming outside. At this point, you can see the main photo. This is our carpal tunnel. Now this tunnel is made by two layers. First of all, deep carpal arches. The arch or the base formed by the carpal bones. And the superficial part, the roof, is made by flexor retinaculum. Why? Because you know this component of the forearm having our flexor muscles, and this component of our forearm contains extensor muscles. Okay, so flexor means at this point flexor. Retinaculum means a covering sheath made by connective tissue. Okay, now so flexor retinaculum. Do you understand? Now the roof is formed by flexor retinaculum and the base or the carpal arch is formed by the simple carpal bones. Now don't confuse at the anatomical position and my advantage position, okay? I am sitting like this and I am placing my hand like this at my comfort level. Never confuse in this anatomical position. Remember always that thumb represents lateral. So laterally you will find here first of all scaphoid bone in this part, okay, scaphoid bone. Then you will find trapezium bone, okay, the tubercle part of the trapezium. These two bones presents laterally. Medially, this part, medially you will find the hook of Hamet and the smallest bone of the wrist joint, which is pisiform bone, this side, okay. So Hamet and pisiform. And now you have to know about the components of the carpal tunnel. First of all, you're going to find flexor pollicis longus. That's it. Then you're going to find 4 tendons of flexor digitorum superficialis, okay, superficial muscles. And then you're going to find 4 tendons of flexor digitorum profundus. This is the deep muscle, okay. So what are the muscles of this flexor component, extensor component? I already talked about these things in muscle videos, in my very earlier videos, okay. Anyway, median nerve also is the component of carpal tunnel. Now I'm going to talk about our femoral components. Femoral means it is the area near to the femur bone, which is a part of our lower limb. Okay. Now, first of all, in this component, I'm going to talk about femoral triangle. Femoral triangle is a depressed area on the front of the upper 1/3 of the thigh, as you can see in this photo, just below to the inguinal ligament. Now you have to know about the boundary. Laterally bounded by the sartorius muscle, and medially it is bounded by the adductor longus muscle. Specifically medial border of the adductor muscle. Adductor longus. And as I said, it is just below the inguinal ligament. So inguinal ligament acts as a base. The apex part is formed by this sartorius muscle is going downside, and the adductor longus is also going downside. Both muscles are going to their each destination, and the crossing point or the overlapping point of these muscles forms a apex. The roof is formed by the skin, first of all skin, then you're gonna find superficial fascia, superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, branches of ilioinguinal nerve, superficial branches of femoral artery, superficial branches of femoral vein, along with the upper part of the end part of the great saphenous vein. Floor is made by the pectineus muscle, psoas major muscle, and iliacus muscle. Okay, so you got ultimately the medial border, lateral border, base, apex, roof, and floor. This is the entire part of the femoral triangle. In the components, you're going to find first of all femoral artery and its branches, femoral vein and its tributaries. Okay, third of all femoral sheath, femoral nerve, nerve to pectineus muscle, nerve to iliacus muscle, lateral cutaneous nerve of thigh, and deep inguinal lymph nodes. And now the today's last topic is femoral sheath. Femoral sheath, femoral sheath, you can say whatever you want, it doesn't matter. Now this sheath is a funnel shaped sleeve like structure which covers the femoral vessels. Now this sheath is made by two layers of fascia. Anteriorly you're going to find fascia transversalis, which is a continuation part of the abdomen. In abdomen you're going to find fascia transversalis, which goes down and it continues as femoral sheath in anterior part, and posteriorly you're going to find iliacus fascia. Now this fascia has three parts: medial part, lateral part, and intermediate part. Now the medial part has the femoral lymphatics, gone. The lateral part has the femoral artery and femoral part or the femoral nerve of the genitofemoral nerve, gone. The intermediate part contains the femoral vein. And now one extra knowledge point for you, that it is very important to know about your Viva practical MCQ based exam. As I said, this femoral sheath has medial part, lateral part, intermediate part, and this medial part contains of femoral lymphatics. Okay, now here you finding the three important point. First of all, this medial part of the femoral sheath is known as femoral canal, gone. As I said, it contains femoral lymphatics. This lymphatics is known as lymph nodes of Cloquet or lymph nodes of Rosenmuller. Now there is controversy who discovered this lymph node first, Cloquet or Rosenmuller. So to avoid this controversy, you have to remember both names, nodes of Cloquet or nodes of Rosenmuller. Whatever option you're going to find in exam, choose any one of them or choose both of them. Both of them are correct. Okay. Now third point is this lymph node drains the lymphatics of glans penis in male and from clitoris in female. These three important you have to remember until your exams are over. Okay. So this is all about today's topics. So see you soon in my next videos with new topics. Till then, bye.